Good afternoon, and thank you for joining us today. Today I'll be joined by Dr. Alex Icu with the Office of Public Health. He will make some remarks later on and answer your questions as well. So getting right into the numbers today, we reported 1,165 new cases of COVID across the state. That was on 20,631 tests. Since our last press conference, we've now surpassed 1.5 million total tests, and you'll see that we're at 133,125 total cases. You might remember that yesterday there was a lower number of cases reported than we've been seeing for quite some time, and also a lower number of tests that were reported. And I think Dr. Icu will address that when he comes up and can answer any questions you might have about that. Today we are also sadly reporting 26 new deaths, so we're at 4,195. Tragically yesterday, one of those deaths was the fourth child in Louisiana to die of multisystem inflammatory syndrome. This is a condition that is associated with COVID, and I know that there's some debate in the medical community about whether this just is one manifestation of COVID in children or whether it's just something that's related. Either way, it's tragic. It's a very serious condition, and it's thankfully a rare condition. But it has impacted 44 children across the state thus far, and as I mentioned, yesterday we had our fourth who actually died from that condition. So I would ask all the people across Louisiana to pray for the parents and the families of those four children. In just a moment, Dr. B is going to come up and give more information on what that condition actually is. Today we have 1,338 patients hospitalized across the state of Louisiana with COVID-19. The good news, that's down 44 from yesterday, and just a little over 2 weeks ago we were at 1,600. So that was July the 27th. So we're down 262 since then, and the reason I picked 1,600 is that in our second surge, that was the low point. I'm sorry, the high point that we got to was 1,600. So we're 262 fewer than that. That's slow and steady progress over the last 16 days or so, I'm sorry, the last 2 weeks. And I'll note that the decline from the 1,600 level actually started 16 days after the mask mandate and the bar closures and the reduced social gathering size. I will tell you there's still a lot of stress on our hospitals across the state of Louisiana, even at that number we're at today. And the stress is both as it relates to bed availability and to staffing. We have 15 hospitals across the state of Louisiana reporting no ICU bed availability today. That's better than where we were a week ago when we had 28. But it's still a very serious situation, and it doesn't just impact the ability of the hospitals to deliver care for COVID patients, but for any patient who might need that ICU bed. There's also a smaller number of hospitals that are reporting that they don't have any med-surg beds as well. And then on the staffing side, there are certainly challenges, not the least of which are posed by COVID directly. The community spread of COVID has meant that more doctors and nurses and other healthcare professionals are contracting the disease, and then they're not available to work for some period of time, and that puts a further strain on staffing, especially when you have elevated inpatient levels in the hospitals. So we're still in a very difficult place, but our trends have been positive over the last couple of weeks. And the progress hasn't been dramatic, but it has been steady. And what I will tell everyone is We owe that progress to the fact that we have more adherence to the mitigation measures. We have more people wearing masks, staying home when they're sick, social distancing when they're out, making sure that they're washing their hands and so forth. Obviously, the degree to which we can get more adherence to these restrictions and mitigation measures will actually show more progress. So we still have some work to do. I would remind everybody we all have a role to play, and it's important that you play those. And this is especially true because we are now opening our K through 12 schools and our college campuses. And so we're going to be bringing more people into contact with one another. So the way we can do this safely, preserve our capacity to deliver health care in our hospitals and so forth, is by everybody doing their part. We are continuing to perform a lot of tests in Louisiana. That's a good thing. Thus far in August, we're at 226,321 tests. We are also seeing turnaround times at in-state labs decrease, which is also a good thing. And there are some indications that out-of-state commercial labs are also starting to turn those tests around a little bit quicker. All of these are very, very positive to report, but we still have some ways to go. Because the sooner we know someone's positive and get them into isolation, the fewer people they're going to make contact with. And that also gives us an opportunity to contact them sooner and figure out who those close contacts were during that period when they were contagious. And it just makes all of the mitigation efforts around contact tracing much more effective. As a reminder, if you are in quarantine because you've been a close contact with someone who has contracted COVID-19, you cannot test yourself out of quarantine by testing negative. You can test, but if you're negative, you still have to wait that full 14 days in order to make sure that you don't become infected and not only infected but infectious and start getting around other individuals. New COVID-19 test sites have been added in New Orleans, so you can go to doineedacovid19test.com. That's doineedacovid19test.com to find the nearest site and sign up. If you have symptoms, if you've been exposed to someone with COVID-19, if you've been in large groups and weren't able to socially distance, you need to get tested. So contact your doctor or go to your local clinic. You can call 211 as well to figure out what the best place is for you to get tested. So at this time, I'm going to ask Dr. Bu to come up and give remarks. I'll ask you again, if you have questions for him, please ask them at the conclusion of his remarks. And when he is done, I will come back up in order to complete my remarks and then take your questions. Thank you.
Thank you, Governor. Thank you all. So as the Governor noted, I did want to spend a little bit of time today discussing multi-system inflammatory syndrome in children because unfortunately we continue to see more cases in the state, and as the Governor noted, tragically had our fourth MISC, as we abbreviate it, related death in the state. So multi-system inflammatory syndrome in children was first really discussed and identified early in the outbreak. The CDC has been providing alerts to those of us in the public health community and to providers across the country since mid-May. And really that followed after that first national wave of COVID cases where certainly many children were also developing COVID, and this, as a result, we were starting to see these manifestations of illness that seems to be associated with COVID-19. Now that many states, especially those of us in the Sun Belt and the South, our neighbors, are also seeing high numbers of cases, we're again seeing more and more children presenting with this syndrome. While it's a relatively rare syndrome to be associated with COVID-19, as the numbers of children that we have increase, we see more cases. So what is MIS-C? It appears to be largely driven by the immune system of the children, and again associated with having COVID-19. Even in adults, I'll say, one of the things that we've learned throughout this outbreak about COVID-19 or SARS-CoV-2, the virus that causes COVID-19, is that part of what challenges people and leads to poor health is the direct impact that the virus has on lungs. But this virus seems to also really trigger very strong immune responses. And those immune responses are something that's very prominent, especially in the people, adults or children, that are ending up in the intensive care units and on ventilators. And so in this case, when we're talking about MIS-C, essentially what we're seeing is likely the effect of the immune system responding or reacting after a COVID-19 infection. And the symptoms that children get across multiple organs are the result of that inflammation. Most children present with symptoms driven by at least 3 different organ systems. So you can think of your heart, your lungs, your kidneys. Those are all separate organ systems. And about a quarter only have about 2 organ systems involved. The most common symptom that we're seeing in children with this syndrome are a lot of GI or gastrointestinal upset, a lot of nausea and diarrhea. But right after that, about half of children also have prominent respiratory problems, breathing problems, and then a rash, having some redness of the eyes, and heart problems have also been well described in children with MIS-C. Right now, we don't really fully understand why COVID specifically seems to be causing this syndrome in children. Likewise, we don't have a specific treatment that we can give to children that we know of, either during their COVID infection or when they present with MIS-C, that prevents or treats this. Largely what we do is support children through, again, this rare but pretty significant abnormality. So nationwide, the CDC reports we've had over 570 children across the country that have developed this syndrome. In Louisiana alone, since the beginning of our outbreak, we've had reports of 44 children, including, again, 4 who passed. Ages have ranged in Louisiana between 2 months and 19 years old. There, again, does not appear to be a clear pattern of who is contracting MIS-C. One of the reasons we want to share that today is because obviously we have a large number of cases in Louisiana of COVID. And so, we're actually 4th in the nation right now for pediatric cases or children with COVID-19. And that makes us a little bit more concerned, certainly at the Department of Health and the Office of Public Health, about MIS-C. We are trying to raise more awareness amongst providers because we do think that supportive care, giving fluids, helping blood pressure stay up in these children is helpful. But that means that our providers across the state have to be really vigilant and have this in the back of their heads when they're seeing somebody with an otherwise unidentifiable, undiagnosable condition that fits this pattern. We want to make sure that they're giving the best care. In addition, I'll just note that in absolute numbers, that's 11,382 children across the state that have had COVID. And just like with other age groups, we're continuing to see increase in children diagnosed with COVID because we're doing more testing now amongst those children. And so we want to be really vigilant and just make sure that everybody is aware of those disorders. We have asked providers to report to us any cases of MIS-C. We just sent out another alert today to providers giving more information on what the symptoms are and how to report. And so we're hoping that we are getting a better sense of who in the state may actually have this condition. The governor also noted on a different topic, yesterday we did have one of the lowest numbers of total reported cases, no longer just talking about children here, that we've had in quite some time. Part of that was because of essentially timing of when we were pulling in labs between Sunday and Monday. And how many labs were reported in either day. So while the 24-hour period I guess what I would say is instead that the number of labs reported yesterday was from less than a 24-hour period. Going forward, that should be unlikely to be the case. We're setting clear times when we're pulling in labs. But there was no anomaly in which labs could report. We did note that many labs are now reporting at a slightly different time of day. And so the combination of pulling in labs a little bit later on Sunday and then having other labs start to report a little bit earlier in the day seems to have led to more labs being classified as Sunday than Monday. Today, however, you saw we're back on sort of a expected number of children, rather expected number of labs reporting with about 20,000 total tests reported in the state. We should probably continue to see those numbers. So with that, I'm happy to take any questions that you have. Sam.
On the lab reporting issue, if you look at like the past 3 days, did you capture all of the tests and cases reported during those 3 days?
Yeah, that's an important, Sam. So there were no rejected cases or tests that were not reported. They were just being put into different. Essentially, our date of reporting would have been different across the last 3 days. It's a good opportunity for me to specify again, we list cases by the date the specimen was collected, so that would not be affected by anything that's happened over the last 3 days. If you look at the curve, and we showed you now, you can actually gate out and look at just the new contribution. That stays the same. The epi curve will not be affected by that anomaly. Saw a question over here, yes. So the length of time that it actually affects the child can be variable, and it has to do with the severity of the illness. And again, right now, mostly what we're doing is supporting these children with fluids. Sometimes when somebody has a big inflammatory reaction, their blood pressure can fall. And so making sure children have fluids, sometimes giving medications that bring their blood pressures up are the main things that we're doing for them. In some cases, steroids have been given to these children. Again, we're talking about relatively small numbers, so we haven't seen any large enough trials to really dictate the care. Also, there's a period of time that appears to be occurring between having maybe the primary COVID illness and developing MIS-C. Since so many children are asymptomatic, we're not able with any kind of certitude to say what is that time period, but it does seem to follow after by several days, if not longer. Please. So myocarditis is a inflammation in the muscle of the heart, and most of the heart is a muscle. So as I said, about a little under half, about 40% of children with MIS-C have demonstrated heart inflammation. There's still studies that are being conducted right now to determine whether it's actual virus presence or if instead what you're seeing is a generalized immune response that's causing that myocarditis. And I'll just say across a variety of different viruses, sometimes we see that the actual virus is infiltrating and causing problems in the muscle. Sometimes it's, again, the immune system's response that seems to be driving the response. We're not quite sure what's going on there. But again, about 40 to 50% of children with MIS-C are having inflammation around the heart. And that's one of the reasons that potentially you're seeing lower blood pressures. Inflammation around the heart makes the heart pumping less effective. And those are some of the children that sometimes get steroids. Yep, please. I'm not familiar with that study. I'll say vitamin D deficiency is relatively prevalent across the United States in general. So there's lots of things vitamin D can be linked to, but I'm not familiar with this particular study. Okay, thank you all.
Thank you, Alex. I know there have been some questions regarding unemployment benefits. We know the enhanced $600 benefit expired July 31st. Congress has not been able to compromise on anything, and so the President, through executive action, I think signed a memorandum that detailed effort going forward to provide an enhanced federal benefit. This is a different kind of program than we're used to. It's actually going to be funded out of the Disaster Relief Fund that is money appropriated by Congress to FEMA, and it's going to require a 25% match from the state if we're going to get the full $400 per week benefit that is envisioned. There is an option, however, that if we couldn't come up with a 25% match, then we could use the state unemployment benefit in order to match, but then the enhancement would be $300 total, not $400 total. And there's some question about whether if we go the second way and just have a total benefit of $300, whether the full universe of unemployed people who were getting the $600 will be able to get the $300. So there's still a lot of questions about this. Secretary Ava Deshwa of the Workforce Commission is actually on the phone with the U.S. Department of Labor right now, trying to get more guidance on this. Again, it's a brand new program, never been done this way, and we're trying to figure out how we can participate, because we know that we have a lot of workers who are unemployed, continue to be unemployed through no fault of their own, and we want to make available to them all of the assistance that we can. But I would point out that the first one of the ways that you can match the 25% or the $100 per week is through the CARES Act. That's more theoretical for us than anything else, because 100% of the CARES Act funding has already been appropriated and allocated. Now, it's not all expended yet, and that's because the CARES Act told us that those dollars needed to be spent in accordance with Treasury guidelines to reimburse eligible expenses through December. And so we're on a timeline, both as a state, but also we reserved 45% of that for local government. You may remember there was also $275 million for the Main Street program, another $50 million for the frontline worker hazard pay program as well. But all of that money has been appropriated and allocated. It's not yet expended because it's designed to take us through December. So we're trying to figure out exactly what we can do in order to afford our workers here in Louisiana an opportunity to participate in the enhanced benefit. And we should have more information on this pretty soon. Again, I know that our federal partners at the Department of Treasury and the Department of Labor are working to try to get that guidance out. And I did get off the phone with Secretary Mnuchin not long before I came in here for this press conference and had a conversation with him. And of course, he affirmed that what I just told you is in fact the case. Now, there are some very specific guidelines and details that they're working right now in order to come up with, so that we can know how to participate and what we can do in terms of getting the match or going with a $300 total enhanced benefit. One of the things that I would want to point out is that given the limitations of the disaster relief fund that FEMA has, meaning that the primary purpose for that appropriation by Congress was for FEMA to use for disaster response, and we are in hurricane season and so forth, that if you look at the available portion of the disaster relief fund and then look back at the burn rate of unemployment benefits, that if every state participated, it wouldn't last more than about 5 or 6 weeks. And so this underscores the need for Congress to come up with a compromise, to sit down in a room and figure this out and pass phase 4 of coronavirus relief legislation that specifically appropriates money in the traditional method that will go to unemployment benefits, much like the $600 per week, whether it's going to be that amount or some lower amount. But we know that the disaster relief fund is not a permanent fix. In fact, it's going to be very short term and not necessarily inexpensive. Because it could be hundreds of millions of dollars for the state to have to come up with just to do the 25% match. the $100 per week towards the $400 benefit. So there's a lot of work that has to happen in Congress, and I'm encouraging everyone there, leaders and rank and file folks, both in the House and the Senate, both Democrats and Republicans, to figure out how they can sit down and compromise and do the people's work. You know that we've reached out to our congressional delegation, specifically talking about the solvency of our unemployment insurance trust fund, and specifically looking for additional appropriations to the states in that Phase 4 legislation that would either be directed to the UI trust fund or at least have the flexibility that we can get that funding into our trust fund, the balance of which is $253 million today. It was about $1.05 billion or so on March the 1st. And obviously the solvency of that fund is severely threatened. And at the current burn rate, we fully anticipate that in the not too distant future, we won't have any choice but to borrow money from the federal government to restore the solvency of the fund. But when you do that, you also then have to pass along a surcharge to employers to make sure that you can pay that loan back. We would not want to do that because nobody thinks now is the good time to have employers paying more. And that was a big part of my conversation with Secretary Mnuchin as well. So at this time, I will take your questions for a few minutes. Sam?
Governor, if you just outlined, it doesn't seem like we have the money to pay our 25% share. Should workers in Louisiana who are unemployed be preparing for a $300 benefit instead of a $400 benefit, or do you think there's any way we can find that congressional?
Well, we're going to continue to pay the state benefit. So you're talking about the enhanced portion. I really don't know yet, Sam, whether we're going to be able to find a way to do the $400 or whether it's going to be limited to $300. My bigger concern right now, quite frankly, isn't just over the $100 difference. It's the universe of workers that we're going to be able to cover, because early indications are that any worker in Louisiana who isn't getting $100 a week in state benefits won't be able to get the $300. So again, there's a lot of details that are yet to come down from the federal government. This is a brand new program using a different source of funding that comes from FEMA. And then the Department of Labor is going to have to put the rules behind it. And then the Secretary of the Treasury is very much involved too. And so we're working through all of that right now. And if I didn't say it, I did say it. Secretary Deshwa is actually on the phone with the U.S. Department of Labor right now trying to figure this out. But I anticipate in the next couple of days, and hopefully no later than tomorrow, I'll be having conversations with the Speaker and the President in order to come up with what our options are and what we would like to do in terms of this enhanced unemployment benefit.
Do you know how many workers currently make less than $100 in benefits and thereby would be excluded? And also, do you know how much a week it would cost Louisiana to do the 25% match?
You know, those are great questions. I'm going to tell you how good those questions are. I asked Secretary Deshwa those questions just a few minutes ago before I came in here. And she's going to have those numbers for me later this afternoon for sure. One of the challenges that we have is that I believe that there are about over 200,000 workers who are getting a benefit but less than $100 a week. I think there are 204,000 who are getting a benefit that exceeds $100 a week and would be entitled to the full $300 if that's the route we go. As far as the total cost, I cannot give that information to you right now. I can only tell you it is very substantial. Yes, sir. Yeah, well, first of all, they're not going to empty that fund. There's a certain threshold below which they will not go in order to protect the ability of FEMA to respond to natural disasters. So it would really depend on how many natural disasters we have for the rest of the year and also the sequence of those disasters, oddly enough. Under this construct, if there's going to be a hurricane to hit Louisiana, you would rather it happen sooner than later before the money's gone. And of course, you have to assume that Congress is going to appropriate more money to refill that fund if it empties and there are natural disasters that have to be responded to. But rather than waiting, like we're having to wait now for the unemployment situation to get resolved, if you're gonna suffer a natural disaster, and every day I pray to Our Lady of Prompt Succor that we won't, but if you will, it would be better, at least from the funding perspective, to have it early, so before FEMA would run out of money. But we don't anticipate that will be a limitation on our ability to prepare for, respond to, or recover from a natural disaster. Yes, ma'am.
On another note, parents in Livingston Parish are already saying that contact tracers have already called them on the first day of school. Do you think that it was premature for K through 12 schools to reopen because of this?
No, and quite frankly, I don't know whether, I'm not sure what report you're citing, and whether any of those contacts actually occurred at school and so forth. I mean, I just think it's premature. But if you look at the ways that schools have reopened, consistent with CDC guidelines, with a large number of their students participating virtually, others in a hybrid approach, so that they're physically present sometime and virtual at other times, in order to allow the school to actually have the space in order to spread them out on the bus and in the classroom, and all of the precautions that are being taken, including not just the physical distancing, but the mask wearing, the hygiene and so forth. I'm not prepared to say that it's too early to open, but I will tell you, we are going to be watching very, very closely. And again, there are many reasons why kids won't need to be in the classroom. Nobody wants to have a year that is lost in terms of education, and potentially could be more than an academic year because they didn't get the last 3 or 4 months from the previous academic year in terms of being physically present in the classroom at least. But these students, it's not just about their education, it's about access to nutrition, social and emotional wellness. This is where mental health needs for a vast majority of our school-age children are addressed, and other things that are essential for our children and their well-being. For example, suspected abuse and neglect that gets reported. Everybody working in a school setting is a mandatory reporter for that. So there's lots of reasons, but we're going to be watching it very, very closely to make sure that it's safe, that we are striking the right balance there, and we will make adjustments if we need to. Yes, sir.
Governor, a few minutes before you came out, the Big Ten officially announcing it was postponing its fall season, including football, while you were in here. Multiple sources now saying Pac-12 will follow the next hour or so, next 30 minutes or so. Obviously, this college football discussion has gone on for weeks, leading up to a culmination this weekend. You see the trends in the data every day. You follow this virus since it started in March. In Louisiana, do you think it is realistic or safe to have football this fall as these conferences start making?
Yeah, and I'm not prepared to answer that question today because they're not starting football today in terms of the games and so forth. But obviously, this is something that's evolving rapidly, and you know, we will have news on that when we have news on that. And I'm just not going to go there today. Obviously, it's a very serious situation. These decisions are not being made lightly. They impact not just the student athletes, but the budgets for the universities and particularly the athletic departments, but also the economy for all of the cities in which these universities are located and so forth. But the public health perspective is number one, and that especially applies to the players. And then beyond that, to anyone who might attend a game. And I know those are separate questions, but we're just not prepared to go there today. Although I was made aware just before I walked in that the Big Ten, and I do believe the Pac-12, has voted as well not to have their fall sports season, including football. Yes, sir.
Does the enhanced unemployment insurance benefit make it more likely that Louisiana will exhaust its UI trust fund?
No, it's already a certitude. Well, it's frustrating for me and for everyone, and I will tell you that every week we have calls with governors. Yesterday we had a call with the White House Coronavirus Task Force, and I was able to listen to other governors around the country of both parties. Nobody, not the president, not the vice president, not Secretary Mnuchin, nobody believes that the executive actions taken by the president on Saturday are a realistic and complete substitute for the legislation that Congress needs to pass. And in fact, they said that expressly. Their first option is still legislation. And in fact, on the unemployment benefit, it doesn't just stop when the disaster relief fund reaches that level. It also stops if and when Congress passes another piece of legislation. So it contemplates that that will happen. And I think we're seeing enough challenges around standing up this brand new program, getting it funded out of the disaster relief fund, having the states figure out how they can come up with their 25% match, or what the ramifications would be if they can't come up with their match, that you're going to continue to see a big push to say this is just not an acceptable alternative to the federal pandemic unemployment benefits that we have been paying up to July 31st. And so for whatever good it might do, I'll say it again now, we need Congress to sit down and work out a compromise, a bipartisan compromise, which by definition neither side should get up from the table happy, but the American people will be better served, and it's critically important. And I didn't mean to make light of the first part of that question, but at $253 million and the rate at which we are paying unemployment benefits as we have to by law, I have no doubt we are going to at some point have a trust fund that is insolvent, and that we're going to have to borrow money unless prior to then phase 4 passes and there's enough funding for the state, and with the flexibility that we can take some of those dollars and put them in the unemployment insurance trust fund. That is specifically what I asked the Secretary for today, because I happen to believe that the folks in Congress are not going to leave and go have this election in November not having done the people's work. And I think that they will pass phase 4 eventually. Hope it's sooner than later. And I do believe that it will have additional funding for state and local government. And I believe the minimum amount of that additional funding will be the same as it was in the CARES Act, $150 billion in the aggregate. And if it were allocated in similar fashion, it'd be about another $1.8 billion for the state of Louisiana. Yes, sir.
Governor, when we first, in I think March or April, got enhanced unemployment benefits, it took us a long time to clear our backlog and figure out how to change the computer system. Do you have any indication of how long it's going to take us, what the timeline is for getting these payments up and running through our system?
Now, I don't think it's going to be a problem with the system. The question is going to be, when will the money be loaded into the account? But I don't anticipate another problem with the system. Where we were going to be challenged, not just us, but every other state in the country, and we had this discussion among the governors. Originally, there was a proposal being considered, and it may still be considered by some in Congress, to make the weekly benefit contingent upon the previous year's earnings. And if we were paying a variable amount to everyone in the state, depending on what they made last year, I can tell you we were going to be months and months and months trying to figure that out and stand it up. But enough states, including Louisiana, pushed back on that I don't think that that's something that Congress is going to do. So standing up these next payments, getting those payments out the door, it won't really be a function of changing our system. It's going to be when will the money be loaded into the account. No, I don't. Again, we are still waiting for the guidelines to come down from the U.S. Department of Labor. They're unofficially discussing this as we speak right now with secretaries of labor, is what most people call them. As you know, we call it the Workforce Commission, but Secretary Ava Deshwa is on that call. She and I will be conferring again after this press conference, and I would expect to have more information for you all on Thursday. Okay, look, I want to thank you all for continuing to cover this. Obviously, very, very important. The most important thing is that we need to continue to drive our numbers down. It is very sad to report these deaths. They are a lagging indicator, but when you start seeing cases go down, positivity go down, and hospitalizations go down, we expect that at some point in the not too distant future we're going to see deaths go down as well. And so this connection between those things, the infections, the cases, the positivity, the hospitalization, and the death, literally adhering to these mitigation measures is about saving people's lives. That's why we say be a good neighbor. Let's do what we can not to transmit the disease to others, so that they end up in the hospital, they end up seriously ill, or they end up dead. It really is about life or death, and it's a very simple, non-invasive, not an overly burdensome requirement, and it does so much good for people. And I continue to hear people say this, well, I feel well, why should I have to wear a mask? Well, those individuals totally miss the point. Up to 40% of the people with COVID-19 are totally asymptomatic. They don't know they have it. If they wait till they develop a symptom to put a mask on, they're never going to put a mask on, but they're going to be spreading that virus. And that's happening every single day here in Louisiana and around the country and around the world. So the way that you minimize this, the way you try to manage this disease, the way you try to preserve the capacity to deliver life-saving health care in our hospitals, the way that you minimize death is you have people wear a mask. And so it really is that simple. And if you think it doesn't work, explain to me why 2 weeks after the mask mandate went into place, we started seeing our numbers improve. They continue to improve. And if we want them to continue to improve, as I hope we all do, then we should all buy into these mitigation measures. And we should buy into the fact that while it's unpleasant, and we hate to interrupt people's livelihoods, the closing bars is saving people's lives. So it's really that simple, even if it's not easy. So I'm encouraging people to continue to do their part. And for those people who have yet to do their part, I'm really earnestly pleading with you. Be a good neighbor. Be a good Louisianan. Wear your masks. Social distance when you're out of the house and not with people of your own household. Stay home when you're sick. Wash your hands frequently. And reduce your activity. Try to reduce your activity by 50%. Don't go to the store as often. Don't go to the bank as often, or the gas station, or wherever. And if we will all do that, we will be much, much better off, especially as we try to keep our economy as open as possible, not going back to phase 1 or phase 0, and knowing that we have schools opening, both K through 12 and higher education. It's critically important that our state come together right now and continue this momentum, accelerate it if possible, and to keep driving these numbers down. Thank you very much.